Okay, we're going to be doing a TB test today. So for this, I'm going to administer this test using the 6 medication rights. Right patient, right dose, right route, right medication, and then right time and right documentation. So for this particular test, I'm going to go ahead and start by washing my hands really good. And then I can go ahead and prepare my medication after I check doctor's orders and MAR and the patient's MAR. While I'm there, double check for allergies. I'm going to use an alcohol prep pad to clean the top of my medication vial. Get that really good and clean. While I'm doing that, I can look for any cracks or abnormalities in the vial. And this has already been opened once, so I also need to check and make sure that it's been dated and timed and initialed by the nurse who opened it, and make sure that it's within a 30-day expiration period. I have a 1 milliliter syringe that I'm going to be using for this. So doctor's orders on this is going to be 0.1. You never want to use more than that for an injection of this type. It's usually somewhere between 0.01 milliliters and 0.1 milliliters. So I'm going to go ahead and open my syringe and go ahead and uncap my needle without touching anything. I'm going to withdraw my 0.1 milliliters of air so that I can go ahead and inject this into the medication vial. I'm going to go ahead and withdraw 0.1 milliliters of my medication, making sure that I don't have any air, and I do, so there we go. Okay, I'm going to go ahead and make sure that I have the right amount in there, and I do. I'm going to go ahead and recap my needle very carefully using one hand, hopefully. Okay. And after I get everything drawn up and ready to go, I can go back into my patient room and I can identify my patient with 2 identifiers, asking them their name and date of birth, and then verifying that with their medication record and their wristband. So I have the right patient. I'm going to explain the kind of test that we're going to be doing today. It's a TB test. I'm basically going to inject this medication right underneath the surface of your skin, and then what we're going to need to do is we're going to need to see you back in 48 hours to assess your reaction to this test. So what I'm going to do is I'm going to wash my hands really good, and for this patient, since they're sitting comfortably in a chair, we're going to use their inner arm right here. You also can use their upper chest or their upper back if you're doing stuff like allergy testing or anything like that. So I'm going to go ahead and prep my injection site. I'm going to start right here and I'm going to work my way out. And I'm going to, while that's drying, put my gloves on. So I get my gloves on and that's good and dry. I'm going to just very gently, with my non-dominant hand, I'm gonna make sure the skin is taut. And just at about between 5 and 15 degrees, about a 10-degree angle, I'm going to insert just about 1/8 of an inch so that the bevel can be seen just right under the surface of the skin. About like that. Then I'm going to go ahead and inject is 0.1. Okay, I'm going to go ahead and release that, and I'm going to discard into my sharps. And then what I'm going to do is I'm going to go ahead and draw a little circle around here so that when you come back in 48 hours, we can assess. My pen's not working very good. Anyway, draw a little mark there around the wheel so that when you come back in 48 hours, we can assess your reaction to this test. So once you're done with that, you're going to make sure the patient doesn't have any questions. They tolerated it okay. Make sure that they understand they need to be back in 48 hours to be rechecked. And then you're going to go ahead and send them on their way. Go document the site at which you injected the medication and did the test, and how they tolerated the procedure and the time, and make sure you're thorough with your charting, and then you should be good to go.